No, I put it on the PPR live page.
Oh, okay.
Okay, so now I have, cool. Thank you.
Are we good? Okay.
You ready to come back?
Okay, and next time we'll do the intermission.
And how do you
Next break.
how do you want to?
Oh, I wasn't going to take another. Well, all right, maybe I will. I'll take another break. Yeah.
Okay.
What is this segment called?
This one that we just had.
No, this one that we're doing.
This one here. This is a health and wellness segment.
Health and wellness with Dr. Nancy.
Yeah, Iankowitz, IANKOWITZ. I know it's a killer. But my guy's worth it, so.
Name of the guest?
Dr. Nick Mobilia, Mobilia.
Mobilia.
Yes. Can Nick hear me right now? No. Okay.
You ready?
So I'm ready anytime. You are. Welcome back for those just tuning in. This is Marcy's World Live from the Rush Studio in Pawling. This is 103.7 FM Pawling Public Radio, and I'm your host, Dr. Nancy Iankowitz. Now, you know, this is a children's programming hour, and when we discuss children, a common theme centers around sleeping, and more than just sleep habits. In particular, snoring, and even sleep apnea. These are really, really important to pay attention to. So how can you tell if your child is at risk for a breathing problem during sleep? This morning I have an opportunity to interview Dr. Nick Mobilia, who'll be able to shed light on this and related questions specifically surrounding pediatric airway development and its impact on sleep. Dr. Mobilia, are you with me?
Oh, absolutely, yes. It's a pleasure to be with you, Dr. Iankowitz.
Thank you so much. And before I get to you, I'd just like to tell our listening audience a little bit more about you. Dr. Nick M. Mobilia has been practicing dentistry for over 28 years and is at the forefront of introducing new clinical applications in dentistry. He's a well-known industry expert and national speaker. Dr. Mobilia practices comprehensive restorative, oh my goodness, I am so sorry, dentistry with an emphasis on aesthetics. He received his dental degree from NYU College of Dentistry in 1990 and has extensive postgraduate training from many prestigious institutes and academies. He has achieved a fellowship in the Academy of General Dentistry and is a clinical instructor for Dentox, a hands-on training course for the use of Botox for TMJ dysfunction and dermal fillers for dental aesthetics, and more, but I'm not going into that right now. He also devotes part of his practice to dental sleep medicine, treating obstructive sleep apnea and TMJ dysfunction with oral appliances. Just a little bit more about Dr. Mobilia, and believe me, we've cut this down from like thousands of words because he has so many credentials. But as a result of his own personal journey with the diagnosis of severe obstructive sleep apnea, he has become passionate about treating OSA, obstructive sleep apnea, in others. And his mission is now to educate and provide treatment for those who experience this debilitating and life-threatening disease. So using a small device that can fit in your pocket, Dr. Mobilia is changing the lives of children, adults, and seniors. So having practiced dentistry in New York City for 20 years, he recently moved to the area and is pleased to bring his touch and expertise to Putnam Dental Associates in Brewster. So when he's not in the office, he enjoys spending time with his wife, Ellen, and their 2 children. And he's a recent grandfather, and he'd like to use his knowledge and skills to help younger children and adolescents in the local community. So now, Dr. Mobilia, we have no time to talk to you, so I hope you have a really nice day, because I just took all the time with your amazing bio. No, really. Are you still there?
Yes, I'm here.
Excellent. So thank you so much for agreeing to spend time on Marcy's World this morning during our health and wellness segment to help our listeners and viewers, because we're also streaming live. It's going somewhere. I'm not technologically, adept, but we have wonderful people helping us with this. And so thank you for agreeing to help us understand the significance of pediatric airway development and its impact on children. I was surprised to learn that a dentist, I would have thought otolaryngology. So, you know, first I'd like to know, what exactly is sleep disordered breathing, and shed some light on this for us from your perspective.
Sure, absolutely. Sleep disordered breathing is a silent epidemic affecting an overwhelming number of young children suffering from one or more symptoms. It consists of fragmented sleep due to a compromised airway. When a child's airway is narrow, underdeveloped, or constricted in any way, the child is struggling to receive enough oxygen, and this occurs at nighttime. This low oxygen consumption can lead to serious health issues and even poor classroom performance. Basically, your child is choking. They're not getting enough air. They're not breathing.
So they're not sleeping well enough at night because they're not getting the oxygen they need, and it can impact them the following day.
That's correct, because that means that there's a reduced amount of oxygen going to their heart, their brain, and their lungs. This reduces cellular and systemic growth at your child's most formative years, which can now be prevented.
I see. So tell me a little bit more about the importance of a child's airway and its development, and also tell me about some of the symptoms of sleep disordered breathing.
Sure. Central issue for many children suffering from the effects of sleep disordered breathing is their compromised airway through its development. When a child's airway, which includes the nasal cavities, the pharynx, and oral cavities, is narrowed, underdeveloped, or constricted, the child will struggle to receive enough oxygen at night, which can result in serious health issues. The Healthy Start program, which I'll be talking to you about a little bit later, will provide your child with an ideal airway by properly developing social control. So, as far as the signs and symptoms, that's a really good question.
Right, but so what should parents be looking for? What is an indication that a child is having difficulty? Well, it's not just snoring because they have a cold. I mean, how can a parent tell the difference? Because this can be a life-threatening condition.
Well, that's where we come into the signs and symptoms, and these are some of the things that the parents need to focus on.
Okay.
First is ADD, ADHD, and we know that this is such a controversial and overdiagnosed process in today's society. It seems that every child has this. Another one is bedwetting. Did you ever think that this was caused by not having enough oxygen going to the brain? Well, if you follow my train of thought, you might have a solution to bedwetting, and that would be by providing more oxygen.
So hold on, I'm just, forgive me for interrupting for a second.
Sure.
So if I'm understanding you correctly, the diagnoses of hyperactivity disorder, attention deficit hyperactivity disorder, attention deficit disorder, ADD, or even, I guess, any of the other diagnoses that are along perhaps the spectrum, are exacerbated by, I don't know, if I understand you correctly, you're saying this causes or can exacerbate and make worse these diagnoses?
It can exacerbate and make worse.
Yes, that's what I thought I understood. Okay.
And there's been 50 years of research with one of the companies that I work with. So this is not really something new. It's just now becoming mainstream.
So oxygen at night, together with sometimes food allergies, because we know food allergies can severely impact and negatively impact, as these conditions. So there are many things. You can't just name it, blame it, and tame it. Just give somebody a pill. We have to look at the diet. We have to look at the sleeping. We have to look at the airway. So if your child is snoring or whatever the symptoms that the additional ones you'll give us to look at, people can observe this. Parents can observe this in their children, and then get their children examined for this condition to see if this is contributing to. So it's not just during sleep. Actually, it's if the kids are not performing well in school, then we need to also take them to the dentist who's skilled in this.
That's correct. All right, I would like to go over a few other symptoms,
Okay.
because this is something that the parents need to pay attention to. And you're right, it doesn't only happen at nighttime, but some of this can be observed during the daytime. For example, mouth breathing. Did you know that nature intended us to breathe through the nose and not the mouth? I mean, I didn't know that myself. Growing up as a child, I thought we were supposed to breathe through, the mouth. And even when playing sports, as I was gasping for air, I was trying to breathe through my mouth and not use my nose. this could have created problems that I wasn't even aware of.
Yeah, I'm just flashing my husband a look right now because he's in the studio with me, and you are so up my alley right here. So keep going, Dr. Mobilia.
Anyway, air, once it's filtered properly through the nose, which contains tiny hairs called cilia that sweep mucus from the nasal cavity into the back of your throat, where it can be swallowed and neutralized in your stomach. These tiny nasal hairs trap dirt, viruses, bacteria, and toxins until we discard them through the mucus that we form. If you're breathing through your mouth, this filtration process really isn't occurring, and that's why it's important that we really should be nasal breathing and not mouth breathing. Another symptom would be snoring. When I ask my patients if they snore, right away I get a chuckle or a laugh. Part of the snoring is really not funny. Snoring can be a sign of obstructive sleep apnea, which is a topic in itself that perhaps, who knows, on another show we might talk about. Obstructive sleep apnea is a debilitating disease, can eventually lead to death. It's not funny at all. So when you hear people snoring, please take this seriously and have them seek proper assistance.
I agree. I agree with you completely. And snoring is also negatively impacted by people who have swollen sinus cavities. So even if their sinus cavities are somehow, adequate, if they are swollen because of inflammation from irritants, allergens, what have you, that is something that can also make people snore. In the olden days, they would just take out adenoids or take out tonsils and start taking pieces of people away instead of addressing the actual, problem. Unless that is part of the treatment now. Is that part of?
That's correct. Sometimes that is a viable option.
Uh-huh.
If they are chronically swollen. If there is a problem, sometimes you have to, correct the primary problem, which would be removing the tonsils and the adenoids. So yes, sometimes that is a problem that needs to be addressed.
Okay, fair enough. So, and I guess that now that leads us right into what some interventions are. You just started. We're getting right into the next question I was going to ask you, which is what are some of the interventions? So that's some of them. And while you continue to address some things that we can look for and some interventions, we can talk about how parents can begin treatment or seek treatment with children that are affected. So feel free to throw in thoughts, ideas surrounding all of those options.
Sure. And I just want to go over just a few more. Maybe I'll just list them because I have so many things to say about each. But I want to go over the other symptoms too.
Good.
One of them would be restless sleep, delayed growth, nightmares, daytime sleepiness, dark circles under the eyes. That's something that a parent should be looking at. As allergies, as mentioned before, just as crowded teeth with an overbite. That's something that we should pay attention to. And as mentioned, swollen adenoids and tonsils and aggressive behavior. As far as that's concerned, I'm not sure the mechanism behind that, but we've had patients and even parents give testimonials how they finally had their children come back to them after such a long period of time. As you know, aggressive behavior with bullying of teenagers in schools has been in the news recently and nationally and for the longest time. Anyway, could it be that the perpetrators were not receiving enough oxygen to their brain due to sleep-disordered breathing? I don't know the answer to that, but if properly studied, it's something that we should be considering because I don't think it's really a coincidence.
Wow,
Right.
That's a lot to think about. One doesn't. I can start hearing people in my imagination saying, "Wow, you're a bully. You need braces." I mean, I would. But no, I really, without all joking aside, and thank you for being so generous of spirit with my interruptions, because I always try to make sure I'm understanding correctly. One would have thought that, otolaryngology, the ENT doctor, addresses this, but there's an important and powerful impact that dentists and the right dental examination with somebody who's educated in this can, there are important interventions that can be accomplished by simple visit, but you have to make sure that the person is, licensed and certified. In this way, there are quite a few other things I'd like to get to, but I do want to take a very quick station break, and I think we're just going to take maybe a 30 or 45-second break For those just tuning in, this is WPWL 103.7 FM Pawling Public Radio. You're listening to Marcy's World. I'm your host, Dr. Nancy Iank, who is here during our health and wellness segment with Dr. Nick Mobilia, who is a dentist teaching us about sleep apnea and how a dentist can help improve your child's life. Stick with me, Dr. Mobilia, and guests, and we will be right back.
Nancy, do you want to show the picture?
Right
if
now,
you can put it
doing
up,
that.
I can give you this and you can...
I'll take this off. Alrighty. So here's...
Yeah, let me give you this and then you can just kind of give everybody the info. The other thing I was thinking is
Marcy's World is
Dr. Mobilia could actually watch you on on this Facebook, and I can bring them on Facebook Live.
How to understand and address the unique language of your body is the key.
It gives you an option when somebody tunes in on their phone with their and their camera's active. It gives you an option to bring them onto the Facebook Live so that you can kind of do like a conference.
We don't know if he's like conference.
Yeah, no.
Here's what what are you doing, sweetie, with this? It's frozen, it's not doing anything.
No. Here, just give it a second.
Oh,
Put it
okay.
back up.
I was supposed to do that big, but...
So you
Okay, that's Dr. Nick Mobilia, and he is my guest today on the phone. Thank you for that. Okay. You just do what you do. Stay tuned for part 2. I'll be right back.